Drugs that are used for the treatment of cough are an important part of pharmacology curriculum, but unfortunately they have not been covered in the Kaizen review. If you want to know which book to follow in order to understand and read the antitussive drugs, keep watching till the end. Assalamu alaikum. I'm Dr. Sehrish Zafar and I welcome you to Key to Pharmacology. Cough hota kya hai? Cough is basically a protective phenomena. It is a physiological mechanism to clear the airways. Cough can be acute or chronic. Acute cough means it is going to last less than a month, while chronic cough is the one that lasts more than 1 month. Cough can also be dry or productive. Dry cough means there are no secretions and productive is associated with sputum and secretions. While understanding the cough reflex arc, whenever there is irritation of the bronchial mucosa, it is going to send signals through the vagus nerve to the cough center in medulla. And the cough center in medulla is going to send efferent fibers to the respiratory system and going to stimulate the cough production. Now, the drugs that are used for the treatment of cough can be divided into 3 major categories. They can be antitussives, which suppress the production of cough, or they can be expectorant, which cause expulsion of mucus and secretion, or there can be mucolytics, which break and clear the mucus. Antitussives have a very wide classification. Broadly speaking, they're classified into opioid derivatives and non-opioid derivatives. Opioid derivatives includes codeine, dextromethorphan, folcodeine, ethyl morphine, while the non-opioid derivatives include benzonatate, noscapine, clofenidainol, and prenoxadiazine. These are the selective names that have been taken out of an exhaustive list of antitussives which are obsolete now. So, अगर आपको इतने नाम पता हैं, that is going to suffice for your undergraduate exam. Codeine is a very popular component that is used as an antitussive. Folcodeine के नाम से भी हमने syrup सुने हैं. There are many syrups and उनकी हमने toxicities भी बहुत सुनी हुई हैं. There are often reports of cough syrup associated toxicities and cough syrup associated abuse potential. Codeine causes decreased sensitivity of the cough center in the central nervous system. Basically, it suppresses the cough center in the medulla at very low doses जो कि analgesic dose से कम होते हैं. It can cause constipation as a side effect. The most important problem है, that is the addictive potential again. Dextromethorphan is another synthetic derivative of morphine. Again, because it is an opioid derivative, it is going to suppress the cough center in the medulla. It also has an excitatory action on the NMDA receptors. But the problem again remains that at high doses it can cause dysphoria and hence it can be used for addiction purposes. Benzonatate differs from the opioid derivatives because it suppresses the cough stimulation peripherally. It anesthetizes the stretch receptors that are present in the mucosa and airway passages. तो वहाँ से कोई सिग्नल्स जो ट्रांसमिट होने होते हैं इरिटेशन की वजह से वो ट्रांसमिट नहीं होते हैं. सो पेरिफेरली आप कफ को सप्रेस कर देते. कफ सेंटर सप्रेशन इज नॉट triggered because of inhibition of peripheral receptors. There are certain other miscellaneous antitussives जिनको हम डिटेल में डिस्कस नहीं करेंगे. Noscapine, clofenidainol, prenoxadiazine, these are all peripheral antitussives. थोड़े इनके side effects हैं which we have mentioned along for a good read. The expectorants can be saline expectorant. They can be sodium and potassium citrate or acetate, can be potassium iodide, it can be ammonium chloride or guaifenesin. Expectorants basically increase the bronchial secretion. They reduce the viscosity of sputum and facilitate its removal by coughing. Having said that, expectorants are not going to increase the ciliary movement. Expectorants हम COPD के patients में ज़रूर देते हैं ताकि it will facilitate the expulsion of mucus. But please understand, unless the patient is going to receive chest physiotherapy which helps the patient to expel the mucus, तो तब तक वो expel नहीं होगा. Potassium iodide is one of the expectorant that is to be used cautiously in patients, especially pregnancy में contraindicated है, children में contraindicated है because of its iodine containing side effects. It can cause hypothyroidism or it can cause iodine deficiency in fetus or children. Lastly, mucolytics includes acetylcysteine, ambroxol, bromhexine and carbocisteine. Mucolytics are different from expectorants because mucolytics break the mucus. They decrease the viscosity of the mucus by breaking the polymers in the mucus. However, this is not much helpful बिकॉज अगर हम म्यूकस की विस्कोसिटी को ब्रेक करें तो इट कैन बी एडवांटेजियस के पेशेंट जो है वो उसको एक्सपेल कर सके, बट दैट इज नॉट द केस बिकॉज म्यूकस दैट इज थिक but less sticky can more easily be removed as compared to mucus that becomes slimy and stays inside the lung. So mucolytics are commonly combined with the expectorants. N-acetylcysteine is one of the mucolytics that is available as a 10% solution that can be nebulized. The sulfhydryl groups of N-acetylcysteine interact with the mucus proteins and cause breakdown of the mucus protein. Another advantage is that it also increases the level of glutathione, which scavenges the oxygen-free radicals. Antitussives altogether is a very dry topic because there are a lot of drugs with difficult names and difficult mechanisms. The best book that I've come across so far for the antitussive drugs is Lippincott, which is very student friendly and you can easily understand the basic concepts. I hope this video helped you. If it did, do not forget to like, share and subscribe. Thank you.